Okay, good morning, everybody. Welcome to today's webinar. It's called Guidance for Oklahoma Communities' Use of Opioid Settlement Funds. Thank you so much for joining us today. I'm Jessica Hawkins. I'm the Director of Community and Systems Initiatives for Healthy Minds Policy Initiative here in Oklahoma. We're pleased to be with you today to discuss our newly published guidance document by the same name. You can find that guidance document, if you don't already have it, on our website at healthymindpolicy.org. The guidance document is intended to help you develop a strong local plan to prevent and treat problems caused by the opioid crisis. If you're participating today, you're likely one of the many Oklahoma cities, counties, school districts, or public trusts that are eligible to apply for opioid settlement funds in Oklahoma. And the purpose of today's webinar is to highlight the key takeaways from our guidance document and provide you examples today of best practices for your consideration during your planning. As a matter of some brief housekeeping, today's webinar will be recorded. It'll also be available to access on our website shortly after we conclude today. You may submit questions today during the webinar about the guidance document. If time permits, we may highlight a few questions and answers during the webinar. I want to take a brief moment before we get started to acknowledge 3 team members that are working with the Oklahoma Opioid Abatement Board and the grant program who are here on the call today. If they're able, they can come off camera and say hello. First, introduce Christy Ice and Thomas Snyder, both Deputy General Counsels with the Office of the Attorney General. And also on today's call is Terry Simonson, Special Counsel to the Attorney General's Office and the Opioid Abatement Board. Welcome.
Thanks for having us.
Thank you.
Thank you so much for having us, Jessica.
Absolutely. Thanks for joining. I also want to note for those participating today that the Attorney General's Office will host a call for applicants on February 9th at 1 p.m. They'll be covering technical questions about the opioid settlement funds and the grant program at that time. They won't be taking questions today, but again, that call will be on February 9th at 1 p.m. Today, we'll focus on the guidance document to help you, eligible applicants, develop your local abatement plans. We'll compile questions that we received today and provide those best suited for the Attorney General's Office directly to their team so they can address those at a different time. Let me tell you a little bit about Healthy Minds. Quick word about us. We're a nonpartisan team of policy and behavioral health experts working to end untreated mental illness and substance use disorders in Oklahoma. We do this through policy and practice transformation. You can learn more about our focus areas and our work on our website. There you'll see our research on Oklahoma's mental health system, Oklahoma's needs, as well as our policy priorities. Healthy Minds also works closely with communities and systems such as school districts, healthcare, and behavioral health organizations across Oklahoma to design and implement new mental health practices. Our team helps community leaders understand the nature of problems in their area experienced by their residents, helps them identify effective ways to address issues. We help communities find the resources they need to implement improvements and to measure their impact. We have offices in Tulsa and Oklahoma City, and we're currently supporting communities across the state with issues such as improving mental health crisis response, school-based services, substance use treatment and overdose prevention, children's mental health, and much more. Next slide. And now I'll introduce you to our panel of experts from Healthy Minds. Today we have Emily McPherson, Cassie Morgan, and Lee Fisher. Each of our team members today have worked in the behavioral health field at the state and local levels, including a focus on the opioid and overdose crisis for many years in Oklahoma, and also in roles outside of the state. First, to kick us off, Emily will open us up with a brief overview of the opioid crisis in Oklahoma. Emily?
Thank you so much, Jessica. Like Jessica said, I'm Emily McPherson. I'm a fellow at Healthy Minds. I know that for most of you, I don't need to reiterate how important this crisis is. but I do like to share this number that since 1999, more than 1 million people in the United States have died from a drug overdose, the majority of which did involve an opioid. And Oklahoma has felt this crisis even more acutely than the rest of the nation. In just 2017 alone, opioid use disorder and fatal opioid overdoses cost Oklahoma more than $10 billion. And that number includes factors like cost of healthcare, treatment, lost productivity, criminal justice involvement, and lower quality of life. Rural Oklahoma does face higher rates of untreated substance use disorder and higher barriers to treatment, such as lack of availability to treatment providers, transportation challenges, lack of broadband access for telehealth. All 77 counties face a shortage of mental health providers, and again, that is felt most acutely by rural communities. There has been a high focus on opioid overdose deaths, and rightly so. This crisis has had many negative consequences. The strategies that we will discuss today and that are included in our guidance document that Jessica has talked about will include overdose, but they will also reach beyond. And I will talk a little bit about the co-use of opioids and methamphetamine. Thank you, Maggie. When we were looking at this chart, which shows overdose death rates by substance in Oklahoma from 2008 to 2020, you can see those numbers really start to go up in 2019. Somewhere around 2017 to 2018, methamphetamine overdose death rates surpassed opioid overdose death rates. We refer to the co-use of methamphetamine and opioids as the fourth wave of the opioid epidemic. The first wave started in the 90s with the overprescribing of prescription opioids. That led to the second wave, which was the use of heroin and other illicit opioids, has evolved into the third wave with synthetic opioids such as fentanyl. And then we've arrived at the fourth wave, which is the co-use of methamphetamine and opioids. All of this is explained even more thoroughly in our guidance document. And then just as a note, if you're wondering why those blue and yellow lines end, as fentanyl has become more and more involved in overdose deaths, it became more difficult to discern between deaths caused by prescription opioids and caused by illicit opioids. So now the data that they track is just any opioid. Labeled here are the 5 counties with the highest rates of opioid overdose deaths from 2018 to 2022. And just as a note, rates mean percentage of the population rather than total number of deaths, which is why you don't see the more populated metro areas as automatically the highest. You can see that a lot of rural communities are feeling this, like we have talked about. And this data is from the Oklahoma State Department of Health. And there's just a wealth of information from them and many other places where you can find detailed data about your community. We will talk a bit more about some data resources later in the presentation, and our guidance document has additional resources as well. And now Cassie will begin our conversation about settlement funds and their principles.
Thanks very much for providing that background and context, Emily. To help states and subdivisions plan for how to use the settlement funds, national experts developed these 5 different guiding principles, which we're going to walk through here. The first principle is to spend the money to save lives. So rather than filling holes in existing budgets, the funds should be used to expand necessary opioid programs, including prevention, treatment, and recovery strategies. We're going to talk about some of these strategies a little bit later. But if your community has existing strategic plans, for example, addressing opioids, those could be utilized to help you prioritize how to spend that funding. The second principle is to use the evidence to guide spending. Well, like I said, we're going to spend some more time on this later in the presentation and provide some specific examples. But we really want to stress the importance of prioritizing interventions and programs that have been rigorously tested and proven to effectively treat and prevent opioid use disorder. These strategies will have the most impact on your communities. Investing in youth prevention is the third principle. Like I just mentioned, funds should be used on research-backed prevention strategies for youth. to stop use before it starts. Jessica is going to talk about some of these strategies a little later and highlight examples of effective school-based programs. The fourth principle is to focus on equity. Different communities and populations are disproportionately affected by opioid use. As we just saw in Emily's map of opioid overdose deaths, some rural counties in particular had the highest opioid overdose death rates. So communities should use the funds to attempt to address disparities and increase access to treatment. And the final principle is to develop a fair, transparent process for deciding how to spend the funding by seeking input from the community and using data to identify areas of greatest needs. Lee is going to speak more about this and will tell you about how to plan for and implement grant funds.
Thank you, Cassie. So I'm going to take a few moments here to walk us through a framework that could help you think about how to plan for the use of grant funds and how to implement successful, effective programs. The steps of this framework involve engaging others in your community in your planning and implementation process, examining needs and gaps so that your programs are responsive to community needs, defining clear goals and objectives for your programs and services, and just as Cassie emphasized, selecting evidence-based practices to avoid the potential for harm or increased risk that can occur when you do not use evidence-based practices. So following this framework, and we're going to talk through each piece a bit more, will help you avoid some common pitfalls that occur with inadequate planning or lack of stakeholder involvement. So again, we're going to walk through each of these steps to help you avoid some of the potential problems that could come up. The first step is commit. So we're going to start by talking about engaging others. Engagement of local stakeholders or people who represent different organizations or different types of expertise in your community is really important for all public health planning purposes. So, for example, you might start to think about who within your broader community should be at the table as you think about the use of opioid grant funds. You might convene people who represent different public health agencies, schools, first responders, those who have prevention expertise, large employers in your area, individuals or families who've been personally impacted by the opioid crisis, as well as local CCBHCs. CCBHCs are certified community behavioral health clinics. Each county within Oklahoma is represented by a CCBHC. You can go to the Department of Mental Health if you're not aware of who your CCBHC is in your area, you can go to the Department of Mental Health to find out more information and to get in contact with your local CCBHC. But CCBHCs have expertise in the continuum of care, in prevention, intervention, and treatment. They provide evidence-based treatments to address opioid use disorder and other substance use and mental health concerns. So I just wanted to mention that they're a great resource in your areas. In addition to engaging different groups of stakeholders within your area, you might also consider engaging experts. There are state and local experts who've successfully implemented other opioid abatement strategies, who have developed effective programs that have been tested by research that you can call upon to help advise you and to be involved throughout your planning and implementation process. We would encourage you to seek a shared decision-making process. so that you are gathering input from others, including community members, and to help inform your decisions, to help make sense of your data and your findings from your programs. This will help build buy-in and support, and will help you generate champions for your work from the very beginning. We have seen some local entities form advisory groups or councils to help coordinate all of the planning and implementation processes. And some of these partnerships have even been formalized with MOAs or charters that really help define the commitment of the group and the roles of the members. So after kind of forming a group and gaining commitment of stakeholders in your area, the next step would be to assess community needs. And I'm using community to, kind of in the broadest sense, however you define community. You will want your program and your use of grant funds to be targeted towards gaps or needs in your area pertaining to the opioid crisis. A comprehensive assessment will help you identify what those needs and gaps are. They'll help you identify populations of focus within your area where you might want to target services or interventions. And they'll help you prioritize and identify like what is most pressing, what issues can you take on with opioid abatement grant dollars. The assessment process could help you also identify existing assets in your area, resources, other programs that are operating within your community. This would help you prevent duplication and also help you potentially expand programs and services that have already proven to be effective so that you can scale them up to serve more people in your area. So when you think about assessment, there are different methods that you might take. You can do interviews and focus groups with stakeholders. You can consider community surveys. You might, or we would also strongly encourage that you review local substance use data or overdose related data and pay close attention to different demographic groups. So differences in the data pertaining to the different demographic groups within your area. There are many data resources available to you in Oklahoma that are specific to Oklahoma counties and communities. Each county health department has a community health improvement plan. And so we wanted to share a couple of resources with you today, just so you have a sense of what is available. These resources are listed on the slide here, and after this session, the slides will be posted and you will be able to link directly to these resources. So just know that you will have access to this following the presentation today. Really quickly, though, we are going to take a look at the Oklahoma Prevention Needs Assessment Dashboard. This is just one example of a resource that is available to you. This dashboard shows results from the Oklahoma Prevention Needs Assessment Survey. And so those of you who represent schools and school districts that are on the webinar today, you might be familiar with these data, but this dashboard is available for you to take a close look at needs of young people in your communities. So not only are these data relevant to schools, but they're also relevant to communities at large. So we would encourage you to take a close look at this dashboard to help identify needs, help identify urgent behavioral health and other related concerns that youth are reporting within your area. And use these data to help make decisions about how you want to prioritize the use of grant funding. Thank you, Maggie. The next step is planning. So after you've completed your needs assessment, you would want to plan for how to use grant funds according to the list of approved purposes defined in the Political Subdivisions Opioid Abatement Grants Act. And we'll talk more about that in a moment. Again, I would reiterate the importance of selecting programs and services that research has already demonstrated to be effective for preventing and treating opioid-related problems. This will help you avoid unnecessary costs and burdens of developing new programs, and would help you avoid the risk that starting a new program that could be ineffective or could even cause harm. Your plan for use of funds might involve using funding to supplement or scale up other effective programs. I mentioned that earlier, but I wanted to reiterate that in many of your communities, there are strong existing services, prevention, treatment, intervention, and you might consider planning to use funds to help scale up some of those existing programs. We would recommend that you prioritize strategies or services that are not reimbursable through Medicaid, private insurers, or sustained by other funds. After planning, then it's time to implement. Your advisory committee or your stakeholder group can help you determine who should be involved in the implementation and evaluation of your program. Who will be trained to deliver the practices, who will be responsible for collecting data and reporting data to others to help monitor and report on progress and successes. As you start to implement, you may encounter barriers. And so it's important to be adaptable as you're implementing. You might face staff turnover or low participation rates. If so, be prepared to adjust, adapt if necessary. Most evidence-based practices have manuals and guides available to you publicly that can be used to provide training, to help monitor for fidelity, to provide assistance throughout the implementation process. And again, an evaluation plan can help you identify problems as soon as they start to emerge. If you're looking at data, you will see potential issues as they're arising. You'll be able to adjust rather than waiting until the end of a program to start to evaluate. We would encourage you think about it from the very beginning through the lens of quality improvement. And if you start to see issues, you can adjust and improve the quality of the services that you're implementing. Okay, now that we've walked through that framework, we are going to talk a little bit about the approved uses for opioid settlement funds.
Hey, Lee.
Yes.
I'm going to cut in with a quick question about the framework.
Oh, sure.
When we're talking about the commitment phase and engaging local stakeholders, do you think there might be a conflict issue with experts who may also want to obtain funds?
I think it probably just depends on a case-by-case situation. I don't think it hurts to reach out to experts and consult and just talk about like what you're wanting to do within your community and how they might be able to help. And if they feel that say it's a researcher at the university, they feel like maybe it's not the right fit for them to get involved in your effort, they can let you know. But I think that generally people with expertise in this field want to see others be successful, want to engage communities in implementing evidence-based programs with fidelity to the models that have been tested. That's generally how overall we can all be successful, is by supporting each other.
Absolutely. Thank you.
Good question. Any other questions, Emily, related to the model or the framework?
No?
Okay. So there's a Venn diagram on the screen right now. This diagram shows different documents that describe the approved uses for opioid settlement funds. And we wanted to show the overlay between these sources. So on the left side is Exhibit E from the National Settlements list of opioid remediation uses. So often when you're reading about opioid settlements, you will see reference to Exhibit E within the settlements themselves. And again, this is the list of opioid remediation uses that were approved in the settlements. On the right side, you have the Oklahoma statute. So the approved purposes in political subdivisions, Opioid Abatement Grants Act. So within the act, there is a set of approved purposes for use of opioid settlement dollars. What we at Healthy Minds did is review these two sources and consider within these lists of approved purposes, what programs are most needed in Oklahoma? What evidence-based services, practices fall within these broader lists of approved purposes? And we developed a comprehensive list of services, programs, practices for Oklahoma subdivisions to consider implementing. And these are outlined in detail in our guidance document that many of you have seen. We in determining what constitutes an evidence-based practice, we look to federal clearinghouses. So many of the federal agencies have clearinghouses or inventories of evidence-based programs. So these are programs or services that have met like a high level of criteria in terms of their research methodology, their outcomes. So we looked to those clearinghouses to identify evidence-based programs. We also looked at the academic research literature and other credible sources, such as the National Association of Counties Opioid Solutions Center. So NACO has an opioid solutions center, and they also are developing guidance for counties and other subdivisions around how to effectively use settlement funds. So again, we looked at all of these sources to come up with the inventory that is outlined in the guidance document. In the guidance document itself, you will see strategies that fall in different categories in what we consider to be the continuum of care. So many of you might be familiar with this pyramid or triangle that's appearing on your screen. This comes from the multi-tiered systems of support framework that are implemented in schools. But we really feel like this generally applies to all communities, and thinking about planning and implementing funds to address behavioral health concerns. And so there are prevention programs in our guidance document that can be universally applied to populations, schools, to help prevent risk factors. There's intervention services that can be more targeted towards people who are maybe already experiencing risk or demonstrating risk behaviors. And then there are treatment strategies within the guidance document that are evidence-based treatments for opioid and other related issues. We would recommend that you use a blend of strategies across this care continuum as you're planning and implementing grant funds. All right. With this, I'm going to hand this back to the presentation back to Cassie to talk about evidence-based practices a bit further.
Thanks, Lee. So Lee just spoke about Exhibit E and Oklahoma's approved uses. Within the larger guidance document, we summarized evidence-based practices for opioid abatement according to these 7 categories on this slide, informed by the approved uses and purposes. So the categories are medications for opioid use disorder, therapeutic interventions, recovery support services, harm reduction services, care for special populations, including pregnant or parenting women with opioid use disorder, and people involved in the criminal justice system, and prevention. So we're going to highlight 3 categories of evidence-based practices from the guidance document, focusing in on therapeutic interventions, recovery support services, and prevention. Many of the interventions we're going to highlight already exist or are supported to some extent in Oklahoma. I see there's a question here about this. This just means that eligible subdivisions don't have to start from scratch when it comes to implementing opioid abatement strategies. Rather than, duplicating existing strategies, you could consider expanding upon certain programs or leveraging existing strengths of those programs that already exist. But like Lee mentioned, engaging in an assessment and planning process can help you to select and prioritize strategies to implement with the grant funds. Can go to the next slide. There we go. Thank you, Maggie. So we'll start by highlighting some examples of therapeutic interventions. This strategy also relates to medications for opioid use disorder and care for special populations. But ESPERT, motivational interviewing, and contingency management are 3 examples of evidence-based practices to treat and screen for opioid use and misuse. ESPERT is screening, brief intervention, and referral to treatment. It's an approach that can be used in healthcare and other settings to identify people with substance use concerns, provide them with brief interventions, and connect them to treatment services through timely referrals. Motivational interviewing is a technique that's grounded in good listening, communication, and engagement skills. It empowers people with substance use disorder as the experts in their own lives. With guidance and reflection, they can work collaboratively with a clinician to begin to plan for change and set recovery goals when they're ready to do so. This can be used in a wide range of settings and along with other evidence-based approaches as well. It's a very common evidence-based approach. Contingency management is a highly effective behavioral therapy that rewards positive behavioral changes. So most typically it involves distribution of money, gift cards, or other vouchers for submission of drug-negative urine samples. And getting positive reinforcement for those results reinforces abstaining from substance use. Extensive research has proven that contingency management contributes to longer periods of abstaining from substance use, longer treatment engagement, improvement in quality of life and social functioning, and other positive outcomes. And it's also important to mention that contingency management training is available in Oklahoma through the Department of Mental Health. We also want to make sure to highlight interventions that are effective with youth and in school settings. So here we have motivational enhancement therapy, cognitive behavioral therapy, adolescent community reinforcement approach, and recovery supports, which have all been tested in schools and are best practices to treat substance use disorder. So for the school districts applying for funding, we would encourage you to explore these approaches and consider using the grant funds to implement or expand upon a combination of these strategies. The second strategy we're going to discuss relates to recovery support services. A strong array of recovery support services is very important for helping people to maintain recovery, attain housing and employment, and improve quality of life and health outcomes. It's an essential component in the continuum of care, as Lee mentioned. Maybe Lee mentioned earlier in describing the triangle there. Peer support services provided by people who share similar experiences with substance use and mental health conditions are key to enhancing those treatment the modalities and improving outcomes. Peer support's been shown to increase and improve engagement with services, improve quality of life, decrease hospitalizations, and reduce costs of services. Peer recovery support specialists are trained and certified by the Department of Mental Health. Employment provides benefits beyond income for people with substance use needs or who are in recovery. It can increase self-esteem, social integration, and participation in the community, reduce symptoms, and have a positive impact on life satisfaction. Supported employment is an evidence-based approach that emphasizes helping people gain competitive work in the community in jobs they prefer, while also providing supports to help them maintain employment. And there's a strong connection between substance use and housing instability. Recovery-oriented housing services like Housing First, permanent supportive housing, and recovering housing fill a crucial gap for people in recovery or people who use substances. These services help address housing barriers faced by this population by emphasizing immediate access to housing and housing supports rather than waiting for people to achieve a certain stage of recovery. Housing is a basic need and necessary for supporting recovery. So we would encourage applicants to consider adopting or strengthening any of these services as part of your abatement plans to effectively promote recovery. And Jessica is going to share some examples of effective prevention strategies. So I'm going to turn it over to Jessica.
Okay, thank you. And before I dive in to talk about prevention, I want to thank you all for the activity in the Q&A. This is very helpful, and we want to do the best we can to answer your questions. What we won't be able to do today is remark specifically on any of the rules that are governing use of grant dollars. Those would be most appropriate for the Attorney General's office. But the questions that are coming in are fantastic. We're hearing from you questions such as, we have some programs operating in our area that are provided by the state, for example, naloxone distribution programs. Should we avoid those in our plan because they might duplicate what the state is doing? And you've heard Lee and Cassie touch on this, and I think I'll just add a little bit to their responses. It's really important that your local planning community look at the scale at which some of these state programs are operating locally. You all will want to have a local conversation about whether that scale is appropriate for the need in your area and whether there's anything that you might want to add to your grant proposal to increase the utilization of those programs. You might also have a conversation locally about how these programs that are already operating in your area serve or don't serve certain populations. Are there gaps or areas that you know locally could be addressed or boosted with your local resources to make those state programs go even further? And so my answer to that would be no, you should not avoid programs such as those that are already somewhat resourced by the state in your community, but instead with your local planning groups, have these conversations and think about the scale, the populations being served, and whether there's a need for local resources to be applied here. So I hope that's helpful. So talking about prevention, you heard earlier that a best practice recommendation is to invest opioid settlement funds in prevention first. Why is that? And it's because prevention works. We now have decades of prevention science that have demonstrated how to effectively intervene very early before a substance use disorder develops, and even how to reduce risk overall so that, for example, youth substance use does not begin in the first place. The opioid crisis has already experienced a significant shift in Oklahoma due largely to prevention efforts. As Emily told you, the crisis emerged due to largely an oversupply of prescription opioids among large populations of people. Controls on prescription supply, education to prescribers and patients, legal action against opioid manufacturers and distributors have had a major impact on prescription opioid problems like overdose. However, Oklahoma remains in the top 10 states today for prescription opioid dispensing. And that's still a lot of opioid medication that's circulating in our homes and in our community. So the first example I want to provide you of an idea for a prevention strategy is the Department of Mental Health's toolkits that they offer related to safer use, storage, and disposal. There's an online resource that will also provide you a look at the rate of opioid prescribing in your county. Maggie, if you don't mind, you can pull up and take a peek real fast at the CDC's website so you can actually take a look at opioid prescribing and dispensing in your county in Oklahoma. This would be a piece of data that you might want to explore with your local planning group and say, you know, are we in a community in Oklahoma that still has higher than average dispensing of opioid prescriptions? If the answer is yes, by consulting some of this data and local healthcare providers and others in the know in your community, you may decide that your community would highly benefit from promoting a resource that's available from the Department of Mental Health around toolkits for safer use, safer storage, and safer disposal of prescription medications. You might consider, in this case, designing a community-wide promotional effort to increase uses of these practices among your residents. If you're interested in looking at more of the department's resource in this area, you can go to okimready.org. That link is in our guidance document. You may consider partnering with local healthcare practices, schools, faith communities, and more to provide safe disposal units or storage education in your community. A second prevention approach we wanted to highlight, and that we did highlight in our guidance document, is the development of community-based prevention coalitions to organize and oversee comprehensive prevention efforts in your communities. We've highlighted two best practices here for prevention coalitions. One's called the Strategic Prevention Framework, and one is called Communities That Care. Both of these models have demonstrated community-wide outcomes related to preventing and decreasing substance use. They rely on the development of a local leadership coalition, training of coalition members, conducting a community needs assessment, and implementing evidence-based prevention that matches your community needs. I recommend for this strategy that you first check to see if you have one of these strategic prevention framework or communities that care coalitions that are operating in your area. If you do, you'll want to connect with them to learn more about their local plans and their services. These coalitions may have started from a federal grant or received some support from the Department of Mental Health. You can see on a listing that the department provides of local organizations operating community prevention coalitions in Oklahoma on the department's website. Thank you, Maggie, for showing where you can see this. This is also linked in our guidance document. Opioid abatement funds could be used to develop or boost these prevention coalitions in your area, including covering costs of substance use prevention services or programs that are in these plans, most of which are unlikely to have robust funding sources. So our recommendation is that you look into whether you have one of these coalitions operating with these models in your area. If you don't, consider what a coalition like this might do for your community if you were able to resource it. Finally, as another example of prevention that could benefit from opioid settlement dollars, Healthy Minds recommends the adoption of effective school-based prevention programs. An example we're highlighting here is Botvin's Life Skills Training. Botvin's Life Skills Training has been extensively tested and shown to reduce tobacco, alcohol, illicit drug use by as much as 80%. There's also been long-term follow-up studies of this particular program that shows it produces an enduring and long-lasting prevention effect for young people who complete the program. The program is a structured curriculum. It can be delivered to elementary, middle, or high school students over multiple weeks. It works because it develops skills among young people in 3 key domains that we know increase risk for substance use, and that's resistance skills, self-management skills, and social skills. Again, the Department of Mental Health and Substance Abuse Services currently does fund Botvin's Life Skills in some Oklahoma schools, but most schools are not implementing this prevention program. Additional school programs with positive effects are also included in the document in addition to this one. Each of these recommended prevention services are typically pretty low cost and have demonstrated high returns. Healthy Minds included resources in the guidance document for your local planning committee to look at when considering which prevention approach is best. In the document, you'll find inventories of effective prevention services with positive returns on investment. The guidance also includes an online resource for decision makers like you to find a cost-benefit analysis for many of these different programs or practices. You can actually see which programs are cost neutral or produce higher savings than they cost. Here on our slide, we're highlighting for you a resource called the Athena Forum. This is an online inventory of prevention services that have demonstrated effectiveness. And as you can see, it's a long list of compiled prevention services that others have done the work to look at, as Lee described, and show you their evidence of effectiveness. And you and your planning committee will want to explore this. So today, we hope to talk to you and emphasize the need to really focus on a few key steps. First, you're going to want to gain commitment from local stakeholders in your community. The question that came in earlier about a potential conflict of interest, while the answer to that question and good governance and following the rules of the grant program are meant for the Attorney General's office to address in terms of the parameters they'll be setting up for the funds, what's important to note is that it's very likely that many of the subject matter experts or organizations in your community who will ultimately be doing some work with these settlement dollars are also the ones that ought to be at the table early to help your community understand the nature and the scope of the opioid problem and its harms locally so that you can develop a plan together. The point here in our recommendation is that you, as cities, counties, school districts, and public trusts, are not alone in struggling through or looking through and researching and trying to compile a great strategy for your area. You should use these experts in this process. We talked also about assessing local needs and gaps. Lee highlighted for you, and also in the guidance document, are a myriad of online dashboards that you can use to explore things like opioid overdose death, also prescription opioid dispensing, youth risk factors, substance use disorder treatment services that are provided in your area, a wealth of information to help inform your planning process. Today, you heard a really strong emphasis on the use of evidence-based practices. In essence, you don't have to guess about how to approach this problem in your community, and you don't have to necessarily develop something new. Much research has gone into understanding what works in preventing and treating substance use problems and related risk factors. Most people understand that if you implement programs or practices that aren't considered best practice, you may not have an impact. But it's also important to note that utilizing untested approaches could also result in unintended harm. So it's highly recommended that your local plan is based on proven approaches. And today, you learned a lot about state and local resources to help you locally in your planning process. There are even more than was highlighted today, but to get started quickly, we recommend you identify your local certified community behavioral health clinic, or CCBHC, organization, as Lee discussed earlier, as well as any local prevention organizations operating in your area. Both of these systems will immediately be helpful to you in your planning process. We also recommend that you dedicate some time right away to explore those data again. There are folks available at the Department of Mental Health and Substance Abuse Services with Healthy Minds and with local organizations ready to help you navigate some of those data resources. So you can also contact Healthy Minds for more information. On our webpage, you'll see a link called Partner with Us where you can outreach for support. Our individual contact information is also there. I want to pause for a second and thank you for joining us today. I do think there may be a few questions that have come in that we have some time to explore. But as a quick reminder, for those of you who didn't hear the beginning of the call, a recording of this webinar will be available shortly after the call today. And we thank you so much for joining us. I'm going to ask if Emily or Maggie, we've had any questions that we can address before we sign off today.
Yeah, we just have one question left. Thank you to everyone who has left questions. We really appreciate all the engagement. We have one question from someone who said, at Tulsa County, we are very familiar to working through providing funds via the COVID ARPA funds to nonprofits and others. We have found it is better to be more selective on providers so that there is a bigger impact instead of providing funds broadly. What are the thoughts to this strategy?
I think this speaks to having a really detailed strategy and approach. And rather than spreading smaller amounts of money across many strategies to invest in a few key. I think that's the nature of this question, if I'm understanding it correctly. We have emphasized at Healthy Minds the need to look at a blended approach. If it is possible with the amount of dollars that you have available in your grant program to select prevention, early intervention, treatment, and recovery strategies, that can boost your impact to make sure you're blending approaches. But also tailoring. So the importance of this community conversation cannot be understated in convening partners around a table to talk about gaps. In some cases, you may find that you only need a very small investment through your opioid settlement dollars in a strategy, whereas another strategy, for example, has no billable funding sources, has no state infrastructure that's currently supporting it. And so therefore you have to make a large investment there. So it is really critically important that you look across the entire landscape of your school district or your community to see the scale at which these different interventions are currently available and the dosage, we would say, that's needed to make a change. So I hope that addresses some of the question that you're asking.
Also have not a question, but just a suggestion. Many tribal nations have prevention, harm reduction, treatment, and recovery support programs as well. And a reminder not to overlook these potential partnerships.
Absolutely. I could not agree more. Tribal governments in Oklahoma have been incredibly helpful in building infrastructure around substance use disorder prevention and treatment. And I agree completely to engage with these experts in your communities. We're seeing some questions about the use of MOUs or written agreements. As stated earlier in our framework around gaining commitment, the use of written partnership agreements, memorandums of understanding, charters, as Lee discussed, is incredibly important practice. It helps solidify the different roles and responsibilities around your grant program, and also helps with buy-in and helps with some of the back-end reporting and other accountability and good governance measures that are likely to be required with your grant program. And so we also do agree that your stage of gaining commitment from stakeholders ought to include having some shared expectations and signing on to those throughout the process. And the last question I see here, unless there's another one, Emily, that I'm missing, is a question about some samples or maybe a model resolution for this grant. And that's something that we can explore and pass on also to the Attorney General's office. There is a toolkit that's referenced in our guidance document from the National Association of Counties And if I'm recalling correctly, that toolkit does have some sample resolutions and proclamations and others. But that is something also that we can follow up with after the call. You will, as I understand, have contact, if you haven't already, for the February 9th call with the Office of the Attorney General. I'm sure you're looking forward to that. Continue to check back with Healthy Minds as we continue to announce or offer more opportunities to support you in putting your programs together. So thank you so much for joining us today. Take care.